So let's move on to the next case. A 40-year-old obese man comes to the OPD with history of stomach pain localized to the retrosternal area and vomiting since 2 days. On examination, vitals were stable. Abdominal examination revealed tenderness over the epigastric area. Barium swallow on Trendelenburg position shows reverse flow of barium. An endoscopy shows inflammation of esophagus. So what are the key features of this case? Well, you see, he is an obese man with the pain localized to the retrosternal area, very important. Then, abdominal examination revealed that when pressed for any pain in any region of the abdomen, we get tenderness over the epigastric area. Then barium swallow on Trendelenburg position shows reverse flow of barium. Basically, the person has taken the barium swallow, and when he is put on Trendelenburg position, we see that the barium is moving from stomach to the esophagus. So endoscopy is then done, and which shows inflammation of esophagus. So all these points out to the condition that in this case lower esophageal sphincter is not remaining in the constricted state, rather contents are moving from the stomach to the esophagus, and because of this there is pain in the retrosternal area. And endoscopy showing inflammation of esophagus again denotes that because of the reflux of stomach contents, and which contains hydrochloric acid, it is causing the inflammation of esophagus. So the most probable diagnosis in this case is gastroesophageal reflux disease. So let us try to answer some questions related to that. What are the factors affecting the lower esophageal sphincter tone? What is the gold standard for diagnosing GERD? What are the complications associated with this condition? And what is the treatment for this condition? So the factors which predispose to this condition of gastroesophageal reflux disease include the ones which decrease the tone of lower esophageal sphincter so that it opens more frequently and opens when it is not required to open. So these factors include obesity, which is present in our case, pregnancy, presence of hiatus hernia, smoking, consumption of high fatty meal, and certain drugs like beta agonist. Then the gold standard for diagnosis of this condition is 24-hour pH monitoring, because it will tell us that when the gastric contents which contains hydrochloric acid is coming into the esophagus, so that is going to lower the pH in the esophagus. So that is the gold standard for diagnosing GERD. Then the treatment includes first and foremost lifestyle modifications. So the person should avoid smoking, consumption of high fatty foods, consumption of too much tea and coffee as well, because they also decrease the tone of lower esophageal sphincter. Then physical exercise is recommended. Now, if the condition is severe and is not improving with lifestyle modification, in that case medical management is recommended, which is targeted basically to reducing the production of HCl in the stomach. So for that, the drugs which decrease the production of gastric acid in stomach need to be given, which include proton pump inhibitors, then H2 receptor blockers. Finally, if this condition is refractory and is not improving with medical management as well, then there is a surgical management choice also present, that is Nisen's fundoplication. In this, the upper part of the stomach is basically wrapped around the lower part of the esophagus, and it acts as a functional valve. So, the treatment includes lifestyle modification, medical management, and surgical management. Finally, what are the complications of this condition? Well, you see, because the acid is repeatedly getting refluxed into esophagus, it causes inflammation of the lower part of esophagus, that is esophagitis. Then it predisposes to a condition that is Barrett's esophagus, which ultimately predisposes to carcinoma. Then because of repeated ulceration caused by the acid which is entering into the esophagus and repeated healing, fibrosis which is occurring, it can lead to stricture of esophagus. And obviously the damage to the mucosa of the esophagus can cause ulceration and bleeding.